1 out of 136 people are diagnosed with emphysema. Out of the 3 million cases in the United States, 1,500 die each month, 350 a week, 50 each day, and 2 every hour, making a total of about 18,000 each year. Emphysema is a respiratory disorder characterized by problems in breathing. It is the most common cause of death from respiratory disease in the United States.
Emphysema is most common among people over the age of 50. In the late 1990s, males were considered more likely to develop the disorder than females. However, that pattern is changing. The number of women who smoke is increasing rapidly.
Generally, lungs become damaged because of reactions to irritants entering the airways and alveoli.
Researchers continue to investigate the factors that may make some people more susceptible to emphysema than others.
But there are some clear causes for emphysema: cigarette smoking and alpha-1 antitrypsin deficiency, which is a genetic disorder.
A person with emphysema has to breathe harder to take in more oxygen. He or she is often short of breath and may have to gasp for air.
Patients often develop a long-lasting mild cough and may begin to lose weight. These conditions gradually become worse over time.
Once emphysema has developed, there is no way to cure the disease or reverse the damage it has done. However, there are many steps that can be taken to slow the progress of the disease, make the patient more comfortable, and prevent the worst complications of the condition. The first step is for the patient to stop smoking, or the patient's condition will only continue to get worse.
Bronchodilators are sometimes used to help relieve the symptoms of emphysema. Bronchodilators are substances that help tissue relax. They assist airways in opening up to allow air to travel more easily through the lungs.
In later stages of the disease, oxygen therapy may be necessary. Oxygen therapy consists of providing patients with an extra supply of oxygen, usually through a nose or face mask.
Volume reduction surgery is increasingly used to treat emphysema. In volume reduction surgery, damaged portions of the patient's lung are removed. The procedure makes it easier for the patient to use healthy parts of the lung to get the oxygen needed for ordinary functioning.
A treatment of last resort is a lung transplant. In a lung transplant, a healthy lung is removed from a donor and used to replace the damaged lung of an emphysema patient. The procedure is very risky and there are seldom enough lungs available for transplant. Emphysema is a condition that is relatively easy to prevent. The best way to prevent the disease is not to smoke cigarettes or, if a person already smokes, to quit.
A relatively small number of cases are caused by genetic factors over which a person has no control, but the vast majority of emphysema cases result from cigarette smoking.
Patients who have already developed emphysema can take a number of steps to slow its progress. For example, they should avoid breathing polluted air as much as possible.
The pollutants in air have much the same effect on lungs as does cigarette smoking. Patients should also consider being vaccinated against diseases that affect the respiratory system, such as influenza.